This conference will now be recorded.
There we go. And we will upload it to our webinars page at shpllc.com/webinars. You can also visit our archive of recorded past webinars, see our schedule for future webinars, and register for any upcoming special webinars. And included with today's recording will be the slide deck. We will put it up there as PDF, which will also include the reporting requirement appendix. We're not going to get into that today, but it will be available for you to preview. And again, just a reminder, be sure to turn off your camera. Today, we will be hearing from SHP's very own Mike Scribner, who will be giving us an update about the portal and PRF funding. And then we'll have a tutorial with the PRF reporting tool that we built by SHP's Janie Marson. So with that, we will get started. Mike?
Yeah, thanks, Aaron. I'm actually going to kick it to Kelly for the first 2 or 3 slides. We're going to update on the health emergency timing period. So I'm going to let Kelly cover that, and then I'll kind of pick up with the reporting stuff. Kelly?
Okay, great. Thanks, Mike. Thanks, Aaron. Couple of key items about the ongoing public health emergency declarations. So I'm sure, as we've all seen here in Georgia, the specific COVID-19 public health emergency was ended by Governor Kemp on July 1st. There's been some additional orders passed since then that keep some of the pieces going, licensing and flexibility in staffing for providers, but the overall mask mandates, limitations on public gatherings, all of that ended effective July 1st. But the federal public health emergency is continuing on. It was in fact renewed by the HHS secretary on July 20th for another 90 days. And one of the key pieces that keeps in place is the expanded telehealth. We know that there are many of our clients that are still utilizing telehealth for their provider visits. So the national public health emergency keeps that in place for Medicaid, Medicare, as well as the majority of the commercial payers that are covering that. Aaron, next slide. And so what is still coming, we're going to talk about the ongoing PRF reporting, but there is still funding that is out there. Phase 3 distributions from the application cycle last November are still occurring as they continue working through those applications. So we have heard from some clients who are still getting distributions to that. In addition, HRSA has made another rural health clinic COVID-19 testing and mitigation program where they are sending out funding to all of the RHC sites. Each one got $100,000 per site. So those are still ongoing. And then there's still a big pool of money left for HHS. We think there's about $20 billion still left in the pot. Of that, the $8.5 billion was added for rural providers under the American Rescue Plan. So still pending a distribution methodology or application process for that additional funding that they have out there. And as Mike takes over and we get into the reporting and the portal input tool, just a reminder that what we're talking about applies to any of the general and targeted distributions that providers have received. That includes the skilled nursing facilities and nursing home infection control distribution. What it does not apply to, and the funding that does not need to be accounted for in PRF reporting, are your rural health clinic COVID-19 testing program and any claims reimbursements that you've received from the HRSA uninsured portal or the Vaccine Coverage Assistance Fund. And with that, I will turn it over to Mike.
All right, Aaron, flip to that next slide. All right, so to kind of catch you guys up, we have been talking ad nauseum about the reporting to get up to this point. And so what for those of you who thought we were going to walk through the portal itself today, as Kelly was alluding to, We've heard from one or two of you that you've been able to get in all the way to inputs. We've heard from others of you that you haven't been able to, and the sample ones that we swiped to try to play around with it in order to do that weren't working either. And so what we're going to do today is to go over the update of the last 30 days, 45 days worth of FAQs that have come out. And some of it you're going to kind of yawn at, and some of it is kind of game changing a little bit. And so we'll walk through that. And then, as Aaron was talking about, I'm gonna toss it to Janie to walk through a tool that we built such that it can kind of guide you into putting all of your inputs in one spot while tracking to see that you're going to make the answer of justifying the dollars that you got. So that's where we're headed. In terms of deadlines for it, this hasn't changed. We showed this slide last time. If you got money between April 10th and June 30th, then your deadline to 20, your deadline to use the funds is in period 1 of June 30th of 21, which is now passed, and you have to report that by September 30th. And we'll see in just a second that there are no exceptions. We're going to report by September 30th. That's what's going to happen. For those of you who got round 3 money either back in November, December, or the version of that randomly popped up with you guys back in March, April, maybe even into May, that is going to fall into period 3 here. So you have until June 30th of 22 to quote unquote use, either justify by lost revenues or expenses, those funds, and you're going to have to report on that this same time period next year. So that's kind of the timeline around that. Most of your money came period 1, which is why we're in this crunch time to begin with. All right, next slide. All right, so in terms of kind of a few of the FAQs that have come through, number one, when do you have to use the time? When do you have to use the funds? Well, this is no new information. The funds will be available to use for at least 12 months and a maximum of 18 months, i.e. from when you got them, they're considering that really virus-related expenses really couldn't have occurred before 1/1/20 is kind of their arbitrary beginning time through it, and then shooting through June 30th of 21. So it's a maximum of 18 months within there. And so as you'll see in this several times, the questions are still repeating the mantra that it's got to be services rendered, lost revenues attributable to coronavirus, et cetera, on through here. And then it is up to you to maintain your own supporting documentation, that third bullet point there. You don't have to turn it in. You have to maintain the documentation for approval and audit purposes later on. Next slide. So kind of going along with that, they did clarify there was a lot of activity right at the end of June for people trying to go ahead and buy stuff and use whatever funds they had left over. And so they answered an FAQ with purchases of tangible items. You don't have to be in the possession of what you bought, either back order, PPE, whatever it was, to be considered a current expense. However, you got to follow your own accounting process. And so if you were buying something, making a prepayment on a capital asset that wasn't in your hands, if your normal accounting process would have been to go ahead and put that in use and depreciate it before you have it, then I guess you can claim it. I can't really imagine a time that would occur, but that's available. What I think is probably more in line with what might happen is I have purchased supplies. I don't inventory those typically, and I tend to expense it right when I pay it. And so if for some reason you paid for supplies that were en route and your normal accounting process is to go ahead and expense it at that point, then in theory you have claimable expense at that point. Again, I'm not sure anybody that really accounts for it like that, but if that's what you typically have been doing, then you can do it in this case. I think the point of that is really to have locked down all those that were trying to make those purchases right at the very end and try to limit the times that those are awardable, eligible expenses to go against the awarded money. So then the same thing, you'll kind of hear this over and over again, that all those expenses that we're talking about earlier have to be incurred prior to the receipt, prior to the receipt of those payments, so long as they are to prevent, prepare for, and respond to the virus. And so that's always going to be, that's going to be through here several times. And then HHS is saying that they reserve the right to audit the recipients now or in the future. You've already seen the point we were talking about on last couple of PowerPoints, that above 750,000 in receipts, you have to obtain a single audit for your fund usage in the first place. I suppose this is really kind of relating to the ones that got less than that they're reminding us, HHS is reminding us that they reserve the right to audit those as well. Next slide. So this is what I was talking about earlier. Are providers able to request extensions on their submissions? No. If you got more than 10 grand, you are required to report. And if you don't report by 9/30, you're going to be deemed out of compliance. And it's really pretty black and white. Are you able to request an extension on timeline to use the money? No. You had until 6/30/21 to use the money or either justified through lost revenues or actual expenditures. That time period is passed, and presumably if you got money after that, those time periods they will hold to those time periods in the future as well. Next slide. All right, so determining the eligible expenses, this is where you're going to kind of yawn, and there's not just a ton of new information. So how do we determine whether an expense is eligible for reimbursement? Our take is that they believe that the guidance that they have provided previously, that they're really not going to drill down into 1,000 examples and kind of break it down and go through, here's a case study number 1, that's allowable. Case study number 2, that's not allowable, because the answers on these next couple of slides are going to be a little disappointing to you because they're pretty generic. And so the answer to the question, what's eligible, is the expense must be used to prevent, prepare for, or respond to coronavirus. And that's all they had to say about it. It's that you got to then maintain adequate documentation, and you don't have to submit it, but you got to have it, and we reserve the right to audit it. So that's really all there was to the answer. So go to the next slide, Aaron. Another flavor of the same question: if a rent or mortgage was paid during a period, during the right period, but our staff were working remotely, can that expense be claimed? And you see the generic answer that they gave. The amount of mortgage or rent eligible, blah, 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 is limited to that which was incurred to prevent, prepare for, or respond to coronavirus. Not terribly helpful explanation for that. And then the last point down there, bolded, or the next to last point, the burden of proof is on the provider to ensure the documentation is maintained to show that the expenses were applicable in the first place. And so basically, it kind of feels like we're not going to clarify anymore. We're not going through case studies. The general rules are out there, and go forth. And so my editorial comment at the bottom there, noting the trend of the broken record answers, that I'm sure 1,000 more FAQs are going to be posed, but this may be the flavor of the answer we're going to be getting from here on out. Next slide. Now, shifting over to revenues, there's a little bit more helpful information that came out of the last month's worth of FAQs that I do think is a little bit game changing for us. One of the points, and this kind of hits the various hunks of the audience different ways. The question was, there are significant fluctuations that come due to settlements, recoupments, other kind of payments made back to third parties. How should we handle them, was kind of the upshot of the question. And their answer is that recipients shall exclude from the reporting of net patient revenue payments received or payments made to third parties not relating to care provided during that period of time. The interpretation of that, and I think what they're getting at, is if you have your hospital hat on, if you have a cost report settlement that got booked in 20, but was a pickup or a hit related to 19, that they're really saying, go back and consider that being in the prior year. And so even for regular option 1, option 2 answers, move it back into the prior year and show that adjustment like that. Where I think it hits everybody else, hospitals included, are recoupments. Recoupments that frequently the original payment occurred during 19, it got recouped during 20. And so if you're a physician and you're typically cash based at that point, you have extra revenue in 19 and then a reduction of revenue in 20 that is, not virus related. That actually may cut in your favor. But if it would have been in 21, for example, the recoupment of 21 on 20, you may have been undershooting the lost revenue that you could have claimed for the period. And so it seems to me that they're basically saying go back and put the recoupment against the original payment and push it back into the year that it's actually applicable to. Next slide. All right, so the next one, reporting on lost revenues, how do we treat contractual adjustments and charity care adjustments? Basically what they're saying is that we should exclude from quote unquote net revenue that we're basing year over year, or what I'm about to tell you, quarter over quarter lost revenues, that we should exclude contractuals and charity care adjustments out of that. And so our interpretation of that is if you're a hospital and you're accrual based, which seemingly all the hospitals and the CSBs on here would be accrual based, then it's your accrual based net revenue is the number that you ought to be going from, because you will have already taken out not only the actual posted contractual adjustments, but the reserves for additional contractual adjustments on unpaid claims, and then the estimates of that as it relates to charity care as well. And so booked net revenue, accrual based net revenue, year over year, quarter over quarter in that case. And then for a cash-based entity, like most of the practices likely on the phone here, then it shouldn't be an issue one way or the other, because you should be, typically you guys are collections versus collection. And so top line is cash versus cash, and it ought to be a non-issue to you. Next slide. This is kind of where I thought it got interesting. This definitely explains why the inputs on or at least the inputs that they've been telling us were going to occur on the portal were a quarter by quarter basis. That 2 points on this slide. What's the maximum allotment that I can allocate to lost revenues during the period of availability of funds? And what this is saying is you have to report the expense section. However, if you really have no uniquely identified expenses, and there is no limit to how much of your HHS funds can be justified or forgiven or whatever phrase you want to put over that. There's no limit to that can be applied via lost revenues. And so it's not like under the PPP thing, it had to be 60 of this and 40 of that at a max, and at least 60% in one category or the other. It doesn't work like that. It's you report it all, but if you happen to be justifying it entirely via lost revenue, that's okay. The next bullet also I think is pretty game changing. For the lost revenue options 1 and 2, which option, if you recall, option 1 is I'm looking at 20 versus 19, just actual recognized revenue, whatever your accounting methodology is. And option 2 is your budget for 20 versus your budget for 19, versus your actual for 20. So it's budget for 20 versus actual for 20 is option 2. Then it is to be adjudicated on a quarter by quarter basis. Lost revenues are calculated for each quarter during the period as a standalone calculation, with 2019 quarters being the baseline. For each calendar year, the applicable quarter where lost revenue is demonstrated gets added in, and there is no offset. And it'll get even clearer on this next slide, but don't go to it yet. But it reads pretty clearly that it's quarter 1 20 versus quarter 1 19, and then same for all 4 quarters. If I happen to have 2 quarters that are a loss and 2 quarters that are a win, the total of the 2 quarters that are a loss is my lost revenue allotment. And you don't have to offset that with the quarters that are wins. And so let me give you an example. We have a couple of y'all out there who year over year, your revenue was actually up 20 versus 19. And yet you, for the actual, the second quarter, which was down for everybody, you do have a loss for that one quarter. But because we thought that it was going to be on an annual basis. We thought we really weren't going to have lost revenues to claim in the first place. By this, it seems pretty clear that the second quarter or any quarter that happened to be under, in spite of the fact that cumulatively for the year I'm over, or I improved 20 versus 19, the lost quarters are still claimable to be part of my lost revenue. So I'll hit that again in just a second with another FAQ. Then it's a reminder, that last bullet point is a reminder in the FAQ that option 3 is still available. So as any alternate reasonable methodology that they really didn't define a whole lot for, as it relates to, whether or not you added services, added providers, have cost report settlements like we were talking about earlier, new services that launched during 19 but really didn't get going until 20, that we still strongly encourage you guys to run all those additional methodologies if you aren't at a point that it's fully covered, your HHS funds are fully covered on very solid ground expenses and lost revenue option 1 and 2. If you're not on solid ground with those two, then we very much believe that you ought to run multiple option 3s, and I'll tell you a little bit more about that in just a second. Move on to that next slide. All right, what's the baseline comparison period when we're using option 1 or option 2? So option 1 is comparison of actual lost revenues. Option 2 is budgeted to actual to come up with the lost revenue number. And so the first bullet point, the quarters of 19 will serve as the baseline period, like I was talking about before. Second bullet point there, the same thing I was saying a minute ago, if we experienced quarterly losses on some but not all quarters, may the payments be used to cover the losses during those quarter only? And the answer is yes. Lost revenues are calculated on a standalone quarter by quarter basis. And like I was saying a minute ago, the offset of I had pin-up demand that more than caught me up in third quarter or fourth quarter, and it flipped me back to a positive quarter over quarter. That does not have to offset the quarters that we had actual loss for. Next slide. Another interesting concept that doesn't really apply to the current reporting, but might be helpful for future, if you're one of those that got round 3 money that we're going to have to report on later on. The question is, if I have more in lost revenue than I need to justify HHS funds now, can there be a loss carry forward mechanism, think taxes, and that I can use in later reporting periods? And the answer is yes, that it may be applied to expenses, lost revenues for those periods of time later on. It's very clear to say you can't duplicate it, which means if I have $1 million in lost revenue to share to apply, and I only needed 500,000 to cover my HHS funds, I only get to carry forward the 500,000, not the entirety of my lost revenue. I can't use it twice. It's just the amount that's over and above what was needed during this reporting period. And so I think that's helpful, but probably only applies to a fairly small percentage of you guys on the phone. Next slide. This one kind of gets into, well, I guess 2 points. The first one is, how do I know if I'm using option 3, a different alternate methodology, how do I know whether or not my estimation approach is going to be okay? Basically, this is the same thing they said before. If they determine that they're going to review it, and if they determine that your alternate methodology is not reasonable, you have 30 days to resubmit the report using option 1 or option 2, which again, it doesn't delineate any other kind of penalty mechanism for that. So again, kind of reading between the lines, it still feels like if you can't justify by expenses, and if you can't justify by straightforward quarter by quarter calculation under option 1 and option 2, and knowing that option 2 is a non-issue for most of the physician practices on the phone, because you don't really work off of an annual preset budget, and the fact that many of you who don't have a budget that was close enough to the calendar year that the timing of the approval of the budget is going to be helpful, which is a weird anomaly in the rules that option 2 kind of becomes not available for many of you on the phone. But if you are at a point where you're not justifying the funds, it still appears to us that running several option 3 methodologies, picking one that you think is documentable but justifies your money, and then if they don't like it, they're going to kick it back to you and you have to go back to option 1 or option 2. You were in that position anyway, so it seems like trying to find a methodology that's helpful still makes sense. Then the second bullet point there is, how do I appeal if I thought my option 3 method was okay and you said no? What do I do with that? And they're saying that they're developing a reconsideration process to talk it through, to find some way for us to appeal that. And so no details of how that works or how that jives with those that require an audit. So there's obviously more that'll need to come relative to all of that. Next slide. Pretty straightforward. If you've decided that you can't, or if you're turning in an answer that doesn't justify the totality of the funds that you got, if you have to return any or all of the funds, then you have 30 days to do so. And the methodology of returning payment, we've talked about it before, but we can get that information back out to anybody that needs it. Next slide. I guess I kind of summarize this part. I'd still say that there's really no reason to get in a hurry, and certainly not to hit submit. If yours is working, then our strong suggestion would be, whether or not you use our tool that Janie's about to talk to you about or not, that you would go through the calculation in detail and determine whether or not you believe that your funds are fully justified. And then if not, continue working on additional expenses that you can identify or additional lost revenue option 3 alternate methodologies to justify the funds. But I still wouldn't get in a hurry to go ahead and hit send and try to get it in. There are going to be additional FAQ updates that come out. And so again, our points down here, there's definitely continue to look at the expenses, review the available options for accounting for lost revenue, look at the portion of it that's supported via both expenses and lost revenue. And then as new information comes out, we'll continue to update everybody on all that. So, all right, so next slide, and now we're about to pivot for Janie to show you the tool. Our disclaimer on this is that more questions are going to be answered. And so as they are, we're going to try to update the workbook. There is some embedded definition of what's allowable that we're kind of embedding in here. But again, as these come out, our disclaimer is that we need to keep doing the research, and y'all need to keep doing your own research for what is an eligible expense and continue to follow that. This is a good guide to kind of put all that information in one spot, but it's hard to say right now whether or not what Janie's about to go over you, especially related to the expense side, is definitively the correct definitions of what's an eligible and what's not an eligible expense. So with that said, with that, I get that how gutless that disclaimer was, but with that, I'll toss it over to Janie to take over and take a look at the tool.
Good afternoon, everyone. Hopefully I've done that transition correctly and everyone can see the screen, and it's not too much of an eye chart, but there's a lot of information on these tabs as we go through, so that some of them will be a little bit small, and we can certainly, I'll try to zoom in on things and work us through. So generally what we've got is, it's an Excel workbook. If any of you have worked directly with me, I'm a big fan of Excel, so everything lands in here. We've got a whole bunch of tabs to walk us through the various scenarios, and then the couple bits at the end here are the various references from HHS and the PDFs that come with that, so that you have those. Again, the goal with this is to have everything in one spot so that you can kind of put your arms around everything. This isn't going to replace your need to keep documentation and to have other files that augment this, but get all the numbers together so that when you go to input the data into the portal, that you're starting from one place and you don't maybe forget things. Okay. So we start with the summary tab, which is going to be derived from all the other tabs that are in here. And, it kind of walks through what are the justifiable expenses, what are the various revenue calculations, if you choose to put numbers in all of those, and Again, we'll talk about each of these more in detail. Subtotal of what the expenses and lost revenue are, what sort of funding did you receive, what's your total of that, and then a calculation that looks at what's your potential repayment obligation, which is really going to be the difference between what you've been able to justify as claiming and what you actually received. So as long as this number is bigger than these numbers, you're generally in good shape. Okay? And then each of these have the particular references of where they're coming from and what they're doing. This little portion here where we've got them broken out by general and administrative versus healthcare related expenses, those are categories that we see on the documentation. I haven't actually been into the portal, so I don't know if you're going to have to report those individually or if you're just going to report the total of expenses there, but if you need them, it's broken out. Okay. The first tab we're going to go to, of course, is your funds received. And let me make this just a teensy bit smaller so that we can actually look at all of them. All I'm asking you to do here is document the date that you received it, how much, what type of distribution it was. These are all the distribution types that exist. If it was interest bearing, one of the requirements is that if you received money and you put it in the bank because you didn't know where you were going to be this time, a year ago, you didn't know where you're going to be right now, and so you held on to it. If you earned interest on it, you have to justify the interest. I suspect for most of us that that's not really a whole lot of money if it occurred, but if it did, please check the box and report that back to them so that we don't get into trouble over something rather inconsequential. Should it be reported? So right now this is set up to look at phase 1 reporting, which we have to have done by September 30th, as Mike has mentioned several times. And then if you do happen to put in a date, it's just going to tell you too early to report. Delete that back out. We'll regroup about that when we do the next reporting item, which is probably going to be a similar format, but of course we'll have more FAQs that'll come through and we'll look at different time periods. But again, if you got money after June 30th, it doesn't need to be reported right now, just don't include it in here. And then the second portion of that is your other assistance, so that we are ultimately going to offset the provider relief funds that we received here from any other sources that we received funding from. Okay. The next tab gets us into general expenses. So we've got, details if you want to specifically copy these rows and put in additional items. If you had rent on more than one facility or additional utilities that you just want to detail out, however detailed or not detailed you want to keep this, as long as it helps you track kind of where your expenses are coming from and what you've documented. This, I think, is going to be really helpful as well as we move to the second phase of it. If you do have extra expenses that are beyond the funds that you received, we'll have this all documented and then we'll be able to kind of back those out for the next reporting cycle. These couple of pieces here are references that are hidden. If you want to go peek at them, you're welcome to, but it's just going to tell you which category those qualify for and provide some guidance on the definition of that and a little more explanation on kind of what's there. Just make that a teensy bit smaller again. Okay. The next tab looks at, did you want to talk, Mike, for a second about any of these particular expenses? Because I wasn't really going to go into details of, what qualifies as lease or insurance, but.
No, keep going. We can have individual conversations with you guys as you have questions trying to input.
Okay. This next section is to look at personnel costs. And so we've broken this out a little bit to give you some guidance on different items that you could drop in here. They're all generally going to hit general and administrative expenses. Right now we're looking at the regulation is saying salaries directly related to COVID care. So if there are salaries that may not qualify, the landscaper, if you employ a landscaper instead of outsourcing that, probably not directly related to COVID care, and you'd probably want to back out that salary. And if you happen to be paying your landscaper more than $197,000 a year, please back out those portions as well. So these are here. I've asked you to document the entire salary and all of that reduction as well, in case we get further guidance on a broader definition of whose salary can be included, that we'd have that all in this document so that we could swap those numbers out, and you don't have to go chase that down again because the numbers are probably all in one source. But you don't have to populate these if you don't want to, and these portions are included in the calculation at the bottom.
Yeah, Janie, this is related to one of the questions that came in before, and this is probably a good place as any to answer it. The question is, are all salaries considered allowable expenses since healthcare workers are required to be present to provide care to patients of the hospital? I wish the answer was completely straightforward, and that's kind of what Janie's alluding to here. There are a wide range of thoughts going on about what the definition is. On one end of the spectrum says, because all patients that we saw, HHS originally said everyone was COVID presumptive, and anybody that was working clinically or anybody who supported someone who was working clinically, that all of that can be claimed as not just the healthcare workers, but the registration staff, plus the facilities, housekeeping, cafeteria, anybody supporting those people. That on one end of the spectrum is that. On the other end of the spectrum is the very specific version of that discussion, which is if it was an approved hazard pay, if it's an actual allocation of time related to the temp checkers, if it's actual specific category of pay that we put in to address, inefficiencies due to COVID or what have you. I'm not 100% sure. Matter of fact, I'm increasingly pessimistic that tie is going to get broken one way or the other. And we are holding, other tools of other consultants, one of which is on one end of the continuum and one of which is on the other end of the continuum, and not 100% sure how that's going to get broken. Our read of it is pretty broad, but again, I think we're going to have to be very careful about how we document all our rationale to it one way or the other. So all of which is to say, the most solid ground you could be on are directly related COVID expenses and the lost revenues at the end of the day. Sorry, Janie, back to you.
No. Love the dialogue there, and would in fact broaden it a little bit, since some of that PPP reporting required very detailed FTE accounting of the salaries that we were including. I would envision a similar sort of workbook where you're kind of checking off the employees that you could justify as being COVID related and not, and running both calculations simultaneously, and then having that document that would allow you to very quickly move those salaries from one side to the other. Again, until we have absolute clear guidance, as Mike said, a little bit up in the air. And this represents kind of both extremes of the spectrum. The top portion is all in, bottom portion is kind of all out. So, okay.
But Jen, I guess to finish that point, the one other thing I think they're annihilating into the ground is to document your rationale, why you selected your staff and the staff costs that you did. And so if you're going to take a broad view of it, then drafting some sort of narrative that goes with it to basically say everybody was involved in our COVID activities, and because everybody was COVID presumptive, that's why we arrived at the definition that we did. It's clear you're going to have to document some kind of narrative around that. Maybe not person by person, but at least section of staff by section of staff. Okay.
Rocking along. Our next section is capital equipment. So these are falling under health-related costs. Again, a little bit of guidance on what we're looking for definition-wise there. A section to put details on specific items. So again, part of that documentation so that you could tie it back in. You could drop in your asset ledger numbers if you needed to do that, but whatever portion of it works. A couple of these have both a cost and a depreciation component, and the difference is if it was to meet an identified COVID need, so you were doing something only to address COVID capabilities, then the cost of that is 100% claimable in general. If you were doing something to maintain overall capacity so that you could continue to be available to treat COVID patients, but is not directly related to COVID care, then only the depreciation during the applicable period. is claimable. So items listed twice, and that's the reason for that. Okay. And then we move into the next 3 tabs, which are the various lost revenue tabs. And this is running through the calculation. So you can start on tab 1. These items are going to carry over. So the net charges and total revenue will also report on tab 2 and tab 3 for these. So you don't have to enter them multiple times or do a copy and paste. But what we're looking for is reporting. We've taken a very broad range here where we're asking you to go back to 2018 and carry it forward through as much reporting as you have in 2021. And we're set up a little bit prospectively so that as we get into subsequent reporting periods, we have Q3 and Q4 of 2021 in there. You just have to update them. Certainly getting net charges out by payer, general payer class should be okay for you. Getting total net revenue, again, in a cash-based practice is charges and revenue, cash in the door, total charges, those are portions that need to be reported. And then we're doing the calculation here that Mike talked about earlier, where we're looking at the comparison quarter over quarter, and is there a loss in the individual quarter? Of course, lots of dummy numbers in here, so I've set it up that quarter 1 2020 versus quarter 1 2019 in net revenues. The charges are reportable, but the calculations are based on net revenue, is actually up. So that doesn't carry forward, but we're also not carrying forward that profit to offset the losses that we see in subsequent quarters. And then this is just the cumulative, and this number is actually coming all the way back to our summary tab as option 1. Option 2, first 2 sections are identical to option 1. We've just got that third section in here where we're looking at budgeted revenue by payer. And again, ranking through 2018 through 2021. The essential periods to populate are, of course, 19 and 20. Part of the rationale in having that broader look at it is that as we move to option 3, if we have some trending or we want to develop some narrative around trending that we've been seeing, that you, again, have all of that information in one place. But the essential portions are 19 and 20 because that is what the calculation is based on at this point. And again, we're looking at where we budgeted, how did we perform relative to budget. Here, again, push the number so that we get it positive in quarter 2 and quarter 1 of 2020 compared to budget. And then where we're seeing the losses, we're summarizing the loss there. And then as we move to the third option, these are consolidated a little bit because we're looking at some global adjustments. So we've got the unadjusted total charges, total revenue. Budget's probably not really relevant for this version of it, but I included it. And then some various types of adjustments that would either drive your revenues up unnecessarily in 19, so we'd want to back those out, or things that might have been driving I said that backwards, driving your revenue up in 19, which is going to create a lesser disparity to 20. So we would back those things out, or items that are in 20 that really shouldn't have been calculated there that are driving our 20 revenue up that, again, we want to back out a little bit. So we're just trying to, how would we adjust those, and what do these global adjustments do to the charges and revenue that we actually experienced, and then what's our overall year-to-year impact. And this is a starting point, lots of different ways that we could look at the money, lots of different things that you could drop in to adjust your revenue here. And, you know, ultimately this is going to require, I think, a very healthy narrative to go along with it to explain it and just ultimately push through to get that justification for whatever methodology we choose to do. Okay. And then, as I said earlier, the last 3 tabs are kind of notes about different things of kind of what we're random thoughts as we're going through, and then the PDF and the references that are there. These are lots of VLOOKUPs. You probably don't want to fiddle with those too much. Okay. And that is my 30-cent view.
So Janie, go back to the summary. There you go. I think, and this is a question that kind of came up, the good question from Allison. I think the way this is going to work practically is that Allison's point in the chat was to say that make sure that we cover the fact that you can't double dip, that you can't claim personnel expenses that were offset by PPP. That's true. The way it appears to be written, though, is that you're going to come up with all of the expenses that are related and all of the lost revenues. And essentially at the end of the day, that's got to cover the PPP that you got and the HHS that you got. Yeah, it's kind of in pieces, but at the end of the day, like if I'm trying to justify, I got $500,000 in HHS money and $800,000 in PPP money. At the end of the day, I'm looking for expenses plus lost revenues to cover 1.3 million to know that I'm going to be okay from an HHS perspective when all is said and done. One or two of the other questions that came in. Shared savings, any other incentive monies received reported as patient care revenue, should they be reported in their respective quarter? Yes, for a practice side, if you're recognizing cash if you're cash based, whatever the source of revenue was when it hit the practice, that's when you would report it. And yes, it should go into that quarter in particular. And then I think the last question was really, it was kind of saying, in most private practices, there's 4 categories of personnel: providers, clinical staff, front desk staff, and management. Under the broadest definition, I think the question was related to what's an eligible expense. Under the broadest definition, I think you define a practice as being anybody that's touching a patient is almost everybody in there, with the possible exception of the business office and whoever may be doing coding if you're big enough to have somebody just doing that. I could kind of make an argument that everybody else, up to and including the administrator for fairly small practices who's interacting at the line level a good bit, it's just about everybody. And so under that broadest definition, I think you could say it's basically everybody. Just document the absolute crap out of it. But yeah, that would be my thought process. I think that's, oh yeah, okay, one more question. Are marginal increases to obtain and retain staff, use of staffing, and appropriate personnel cost to claim for the CSPs? Clearly, David, if it's incremental and you can document that the increment was caused by prep for that triple aim of COVID stuff, prep for a response to COVID, you're on very solid ground. Again, as that definition moves down the continuum, I think you're already including those marginal cost increases, because if you are taking the broader version of it, a lot of that cost is going to be included anyway. But yeah, David, I think you're on a very clear, solid ground. If you spent recruitment cost or had some hazard pay or what have you, either to add additional staff or to retain your current staff due to the pandemic, I think you're on pretty safe ground at that point. Okay, all right. Well, I guess that'll wrap it up. Good questions, good conversation back and forth. If anybody else has anything, raise your hand now, or certainly we'll holler at us and we'll get some one-on-one time to go over this with anybody. And if anybody wants to go over the tool or, get some time to look at that individually, we're glad to do that as well. All right, with that, back to you, Aaron.
Alrighty, thank you, Mike, and thank you everybody for attending today's webinar. Just a reminder, we will be posting a recording of the slide deck and the slide deck, including the reporting requirement appendix. That's something that we didn't get into. It's about 10 pages plus content that can hopefully answer some of the questions that you were too afraid to ask. But we do have some upcoming webinars as well that you can find on our website. That is shpllc.com/webinars. Next Wednesday, we'll be doing a webinar about the QPP 2022 proposed rule. And then I would expect in mid to late August, we'll do another PRF update. And then there's some other webinars we're working on the horizon, and they will be posted to our website. So with that, I'll give you 9 minutes back to your day. I hope everyone has a great week. And if you do have questions, please feel free to reach out to us. Thank you much.
Thank you all.